As a urologist, a lot of men come to me asking me, how do I make my penis bigger or longer? Well, I have one suggestion for a lot of my men who are obese, and that is to lose weight. I'm very excited to have on a program here today Dr. Arpita Surkunte, who's a weight loss specialist, and she's going to tell us how we can achieve our ideal weight. Welcome to the studio.
Thank you, John. Thank you for having me.
Yeah, so tell us a little bit about your journey in becoming a weight loss specialist. I know you are a board certified internal medicine doctor, and also you went through a special training program to become a weight loss specialist.
That is correct. Yeah, thank you so much. So I am an internist by training, as I mentioned, and then as I was treating patients, I saw many patients who were struggling with weight. At the same time, I didn't have the tools to help them. Simultaneously, I got diagnosed with diabetes, and at that time, I couldn't help myself because as a trained internist, we do not have background in nutrition.
We have very little background in nutrition in medical school.
Yeah. Or residency, for that matter of fact. I'm like, if I, as a doctor, I can't help myself, then I need more tools and I need more education in order for me to help my patients. Then began my journey that I want to reverse my diabetes because of the fact that my uncle died at the age of 55.
Wow.
And my dad had bypass surgery at the age of 55. And as a physician, you kind of have children late because you're going through all these rigorous training and you don't have the time to have children, right? So then, for a long period of time, I went to different doctors and, got professional help, but I couldn't figure out how to reverse my diabetes. At that time, I decided, okay, I need to get more training to help myself and help my patients further, and just became my passion to reverse diabetes, to help people with medical weight management, and their success stories is what keeps me going.
So you started with your diagnosis of prediabetes, and you were looking for answers, you couldn't find them, and you figured, you know what, I need more training, I need more information, and therefore you went through your journey of getting a board certification specifically in weight management.
That is correct. Yeah,
okay.
Absolutely.
So tell me more about weight management. I hear programs on the radio and on TV about all these different diets and things like that. It's hard for me to figure out which is best, right?
Right. And
so
that's
how does for instance, if you have a patient coming into your clinic who is interested in weight loss, what are some of the things that you go through?
Absolutely. So when suppose you are a patient coming to my clinic, I really want to take a good history and ask what your troubles were. Where did you start gaining weight? What are the medical conditions that are causing weight gain? Are there any medications that are causing weight gain? At the same time, are there any behavioral concerns, eating habits, sleep, stress? Because weight itself is related to multiple factors. It could be hormonal, it could be your stress, sleep, your medical conditions. So we just have to figure out what's causing it, find out the root cause.
You mentioned something. You mentioned something interesting. Medicines. You said a medication can cause weight gain.
Absolutely, they can. So there's medications in diabetes like glipizide. They can cause weight gain. There's medications in pain management like gabapentin. They may cause weight gain. There is medications in psychiatric conditions that can cause weight gain. So are there any alternatives as medical weight loss doctors we can prescribe? At the same time, nobody should change their medication without doctor supervision, but that's something I look into. Also, there's so many hormonal causes. Does the patient have insulin resistance? Does the patient have underlying hypothyroidism that hasn't been diagnosed? So kind of figure out what's causing their obesity, or even there's a condition called normal weight metabolic disease, especially Asian people have it. Where you look normal, like your weight is normal and your BMI is okay, but you test your cholesterol, your HDL's low, you're pre-diabetic, and you have insulin resistance. And at the age of 55, just like my uncle and my dad did, they could have a heart attack, right?
Wow.
So how do we prevent that? It's easy to give pills at the disease status. My goal is to keep my patients at the well status, keep them towards the wellness and not towards the disease.
Okay, so tell me a little bit about your journey. How did you go from pre-diabetes to no more diabetes?
So, primarily changing my diet. I used to eat 6 meals a day, healthy meals. That didn't work out for me. I had to increase my strength training, add some more yoga, stress management, sleep management, and eating 6 times a day is not good. So I reduced it to 3 times a day. But there's several other things in improving my gut microbiome. How do you improve your gut health? How do you decrease inflammation in your body? So with my diet, I changed all these things, and I think that's what's helped me. And since 2014 and 2020 now, I've not been a diabetic. I manage it without any medications.
Wow, that's amazing.
Yeah.
If you could have so many patients. I mean, we live in a society of abundance, I would say.
We do, absolutely.
And living in a society of abundance, in the United States, there tends to be a lot of overweight people, and that I see that among my patients.
True.
And obesity is linked with so many things in my world. Guys coming in asking, hey, how do first of all, they tell me that their penis is shrunken, and I tell them, no, it's still there. On examination, I've pushed back their penis, the escutcheon, and I push it back, and they say, see, it's still there.
Right.
And I tell some of these guys, the easiest way to gain an inch and a half back from your penile length is to lose weight.
Absolutely.
But it's so easy to say, and it's so hard to do.
It is.
Everybody, I akin it to saving money, right? So if you save more money, if you make money and then you save it and you don't spend it, then you're going to get to keep some.
Exactly.
Kind of like calories. If you eat a lot of calories and you don't spend it, then you keep it in your body. It's so easy to say, okay, to decrease your caloric intake and then exercise, but as you said, there seems to be a lot of things going on.
Absolutely. So there's new research coming up saying that our gut health is what drives our metabolism, what drives how much weight we gain. It's not just about calories in, calories out. It's not just about eat less, move more. There's so much more to it, right? Do you have metabolic disease? How's your gut health? For example, somebody who has a good gut microbiome, they could be eating, like all of us have a friend or two, right? That eats like so much and they do not gain a single pound.
I used to be like that.
Yeah, how do you do that? Like, tell me. And then there's some people who can smell little cookie and they can gain
they put
a
pounds
pound.
on their waist. Yeah, I get it.
Right? So that could be it. So there has to be more science to it. It is not something without scientific reason. So your gut microbiome plays a big, big role. When I work with my patients, I educate them, I teach them how to incorporate more vegetables, prebiotics, probiotics, everything, and how do you improve your gut health in order for it to work for you, right? When you're eating, for example, if you eat chips and there is avocado, right? So there's inflammation or you're curing inflammation. That's how I like to think about it. So if you're eating chips, you're putting salt, you're putting carbs, and that's causing inflammation and damaging your gut health. But when you're eating, for example, an avocado, you're getting so many nutrients. You're getting healthy fats, which are important for your memory, your brain, your gut health. It has so much fiber that's going to improve your bowel movements and gut health again. I keep saying gut health, but it is so, so very important.
So my solution is to eat the chips and then use the avocado dip, and then we can cancel everything out, right?
You wish.
So tell me more about some of the programs that are out there that I keep hearing commercially that's being advertised.
So
how are they different than what you do in your office?
So I can't say anything about them, but I can tell you what I do. This is my passion. I want your success is my success, right? And the way I do is I'm looking at you as a whole person. I'm not gonna, put you on a cookie cutter here. Here's the diet. Everybody follow this, come back, and you're gonna be successful. My goal is, what are your medical conditions? What's going on with you, with your gut health, what's your family history, how's stress, how's your lifestyle? For example, there's medication, sleep, all of that. And there is night shift workers.
The circadian
rhythms all messed up. How do you match the circadian rhythm to your gut rhythm? How do you match it to your biology? So all these factors are incorporated into the treatment plan. So they'll come, they'll do the blood work, and we'll talk about it. There's a whole lot of education piece, and they talk to me directly. And then I accept insurances because, patients who need help may not be able to afford it. They don't need to, rely entirely on money. But
So some of the programs that are out there for weight loss management, they are cash-based. So that means they don't participate with medical insurance.
Correct.
But you're different.
Yes. So I am taking insurances at this time, and I'll be adding more and more. But I do have some plans I'm contracted with right now. They're on my website, www.newvivamd.com.
So let's take a look at your website, newvivamd.com, and I've already put the link in the video description. Viva, the new you, and looks like medical guidance, long-term solution, prevention focus. And some of the things that you manage are listed on this page. Physician supervised medical weight management, diabetes treatment and prevention, among a lot of different things. And what is so good about weight management and things like that, dietary management, it helps with diabetes, and you mentioned that it may help with hypertension and before, right?
Absolutely. So, when you lose weight, even 5 to 10% weight loss can lead to several, beneficial things for your medical conditions. You may be able to cut down your blood pressure medications. You may be able to reverse your diabetes or pre-diabetes. So those are all the things that can happen, but it has to be done in a carefully supervised, medical weight management setting, because of the fact that you don't want to put yourself in danger with that.
Sounds great. What of the patients that you treated, what is the most common thing that you see as the cause of their obesity?
So most common cause is sugar, sodas.
So dietary
Primarily, but that is what we can change. But I see that obesity is a medical condition. They have it. It's like patients have high blood pressure, right? Patients have, for example, what am I thinking of here? High cholesterol. All these are dietary influenced, but at the same time, there's so much component of your genetics and epigenetics and, hereditary or not. So all those play a role as well.
And that's why you say when you treat your patients, you treat the whole person. It's not like you mentioned the circadian rhythm, you mentioned the sleep habits, you mentioned medications and their history and things like that. It seems like there's a lot involved, not just caloric intake. Part of it is caloric, large amount of it is caloric intake, and then expenditure. But there's a lot of other things going on. Like from what little I know about weight management, Hashimoto's thyroiditis, right? That's something to consider as well.
Yeah, and there's so many cases of undiagnosed or subclinical hypothyroidism. And millennial generation, they don't want to take medications. They want to treat it with diet, exercise. They're ready for it. As doctors, we need to provide them the tools that they're really looking for. They want to reverse disease, and there's some that can be. And if you treat obesity, in fact, obesity is linked to about, don't quote me on it, but about more than 200 medical conditions, and about like prostate cancer, breast cancer, uterine cancer. There's several others, but there's like more than 10 cancers that it is linked to. So you are treating one disease, and you are kind of trying to prevent all these related medical conditions if you're treating one disease. And
for me, I see guys with erectile dysfunction, and the guys complain about penile length. In addition, excessive sugar intake, fructose intake is obesity. They're both linked to kidney stone formation.
Yep, so, kidney stone formation is big.
Yeah, I see a lot of kidney stones. I operated on kidney stones today, this afternoon, or earlier this afternoon. So, and I'm doing 5 kidney stone surgeries tomorrow. So many of these guys and gals are overweight, and I bet in a lot of their diets, they ingest a lot of fructose, especially sodas.
Sodas, and then high fructose corn syrup. All these processed foods. One ingredient is the best. If you eat an avocado, that's great. But if you're eating processed food, if you look at the food label, that's one of the things I educate patients about. In fact, my 9-year-old son knows how to read food labels now. So.
So we talked about the number one thing that you notice, which is dietary. What are some of the biggest success story that you or talk about a recent success story that you have with a patient, and how did that transformation come about?
Absolutely. So I can talk about, of course I can't take any names, but one of my patients, he was having significant back pain. He was referred to me by another doctor, and this patient of mine, he was frustrated with how his back is hurting, was going through treatments, and he wanted to lose weight, but he didn't know how. He's tried other commercial weight loss treatments or some local treatments, and he always used to gain it back.
Yeah.
He's like, I'm tired of losing and gaining it back. And, one of the patients also put in words that if I count how many times I've lost 30 pounds, and if it's 10 times I've lost 300 pounds and all gained it back total, right? So that kind of struck a chord with me. Oh my God. I mean, it means so much for them, right? So this patient of mine, he started working with me in October, and all he is doing is, customized medical weight management plan for him based on his medical conditions. And he's lost 20 pounds. I saw him today, and his back pain's improved. He, may not need as many pain medications going forwards. His energy to play with his children is better.
Yeah.
And the most important part is when I coach him, I see that he's committed to make this a long-term goal. We are not working on short-term treatment plans here.
So he's not going to yo-yo back and forth with the weight gain, weight loss, weight gain, weight loss. That is so prevalent among the different, the trendy diets that we all see.
Mm-hmm. There's so much misinformation. And as a physician, sometimes I have to do research. Okay, this came up. What is the science behind it? Is it really safe for my patients, or is it not safe for my patients? I have to sometimes test their blood, make sure it's not causing any, chemical imbalances, or their thyroid hormones not going up and their cholesterol's not being affected with all these fat diets. So
sounds like a lot of benefits.
It is.
I mean, taking care of the weight can benefit us on so many medical conditions, and including a lot of urologic conditions that I see. So I put your link in the video description. I'll include your office phone number.
Thank you.
And for those who are interested in customized medical weight management, you may want to look up Arpita Surkunte, our medical weight management specialist. And I thank you so much for coming on the program.
Thank you so much, John.
And sharing your knowledge.
Absolutely. Thank you.
All right. If you guys have any questions or comments, leave them below. Her contact information will be in the video description. Bye-bye.